A 2-year-old boy is brought to Ed by his young anxious parents with a widespread itchy rash. They tell you he has not been himself over the last 24 hours. He was sent home from nursery yesterday and he has been feverish, irritable and off his food. The rash developed first on his trunk and has spread over his body and face. What is the most likely diagnosis? Options are A. Rubella, B. Chickenpox, C. Scarlet fever, D. Measles, E. Erythema infectiosum. Pause the video and answer. The child has clinical features of chickenpox. The features of chickenpox include a prodrome that includes nausea, myalgia, anorexia, and headache, particularly adolescents and adults, general malaise, loss of appetite, and feeding problems, fever, characteristic rash, small, erythematous macules appear on the scalp, face, trunk, and proximal limbs, which progress over 12 to 14 hours to papules, clear vesicles, which are intensely itchy, and pustules. Vesicles can also occur on the palms and soles, and mucous membranes can also be affected, with painful and shallow oral or genital ulcers. Vesicles appear in crops. Stages of development of the rash can therefore differ on different areas of the body. Crusting occurs usually within 5 days of the onset of the rash, and crusts fall off after 1 to 2 weeks. A 5-year-old boy is brought into Ed with a rash that has developed over the last 24 hours. The child did not receive childhood immunizations due to his parents' fear of harmful effects. The rash started behind his ears and extended to his face and neck before spreading over his trunk and extremities. On examination, you note cervical lymphadenopathy and petechiae on the soft palate. What is the diagnosis? Options are A. Measles, B. Scarlet fever, C. Chickenpox, D. Rubella, E. A fifth disease. The answer is D. Rubella. A 63-year-old woman presents to the emergency department with a one-day history of widespread rash and fever. She has no past medical history other than a recent chest infection for which her GP prescribed antibiotics. On examination, you note a whole-body exfoliative rash that is hot to the touch. What is the diagnosis? Options are A. Toxic epidermal necrolysis, B. Erythema multiforme, C. Erythroderma, D. Staphylococcal scalded skin syndrome, E. Scarlet fever. The answer is C. Erythroderma. Erythroderma is the term used to describe intense and usually widespread reddening of the skin due to inflammatory skin disease. It often precedes or is associated with exfoliation, skin peeling off in scales or layers, when it may also be known as exfoliative dermatitis, ED. Idiopathic erythroderma is sometimes called the red man syndrome. A 67-year-old man presents to the emergency department complaining of a pain deep within the right ear and a right-sided facial droop. On examination, you note a vesicular rash on the skin of the auricle and ear canal. What is the diagnosis? Options are A. Bell's palsy, B. Trigeminal neuralgia, C. A Ramsay-Hunt syndrome, D. Syphilis, E. Dermatitis herpetiformis. The answer is C. Ramsay-Hunt syndrome. Herpes zoster oticus, Ramsay-Hunt syndrome, occurs when the virus infects the facial nerve, cranial nerve 7, and is characterized by lesions in the ear, facial paralysis, and associated hearing and vestibular symptoms. A 56-year-old woman presents to the emergency department with a one-day history of a painful rash on her torso. She has a past medical history of type 2 diabetes mellitus. On examination, you note a vesicular rash on the right side of her torso following the T6 dermatome. The rash does not cross the midline. What is the most common complication of this condition? Options are A. Peripheral motor neuropathy, B. Persistent neuralgia, C. Encephalitis, D. Chronic changes in pigmentation, E. Keloid formation. The answer is B. Persistent neuralgia. Postherpetic neuralgia, defined as pain persisting for or appearing more than 90 days after rash onset, is the most common complication of shingles and is caused by herpes zoster-induced peripheral nerve damage. A 45-year-old known IV drug user is brought to the emergency department after being found at home by his mother, unwell with fever and a painful left leg. He self-discharged 3 days ago from hospital where he was being treated for cellulitis. What is the management of this condition? Options are A. Broad-spectrum intravenous antibiotics, B. Urgent fasciotomy, C. Urgent surgical debridement, D. Dressings and topical antibacterial agents, E. Anticoagulation. The answer is C. Urgent surgical debridement. Definitive treatment of necrotizing fasciitis is surgical debridement, repeated as necessary. When debridement is performed, surgical incisions should extend beyond the areas of visible necrosis and the entire necrotic area excised. A 19-year-old woman is brought to the emergency department with a generalized painful blistering rash. She has recently completed a course of antibiotics for a suspected urinary tract infection. She has been complaining of fever and malaise for the last 3 days. She noticed the rash on her torso last night and it has rapidly spread onto her face and limbs overnight. She has painful blisters on her lips and the inside of her cheeks. What is the diagnosis? Options are A. Toxic shock syndrome, B. Erythema multiforme, C. Staphylococcal scalded skin syndrome, D. Stevens-Johnson syndrome, E. Pemphigus. The answer is D. Stevens-Johnson syndrome. Stevens-Johnson syndrome, SJS, is a severe skin detachment with mucocutaneous complications. It is an immune reaction to foreign antigens. SJS is a more severe form of erythema multiforme major and a less severe manifestation of toxic epidermal necrolysis, TEN. Both SJS and TEN are characterized by the detachment of epidermis from the papillary dermis at the epidermal-dermal junction, manifesting as a papulomacular rash and bullae. A 6-year-old girl is brought to the emergency department with a one-day history of a widespread, itchy red rash. You are able to diagnose chickenpox. She has no past medical history and is otherwise well. What is the recommended management for this patient? Options are A. Discharge with oral acyclovir, B. Admit to hospital for observation, C. Discharge with topical acyclovir, D. Admit to hospital for intravenous acyclovir, E. Discharge with self-care advice. The answer is E. Discharge with self-care advice. Acyclovir is not recommended for otherwise healthy children with chickenpox. Symptomatic treatment includes paracetamol if pain or fever are causing distress. Avoid non-steroidal anti-inflammatory drugs. Topical calamine lotion to alleviate itch. Chlorpheniramine for treating itch associated with chickenpox for people 1 year of age or older. A 32-year-old man presents to the emergency department with a rash to both arms. On examination, you note target lesions. What is the most likely precipitating cause? Options are A. Cytomegalovirus, B. Penicillin antibiotics, C. Anticonvulsant drugs, D. Herpes simplex virus, E. Streptococcus pyogenes. The answer is D. Herpes simplex virus. Erythema multiforme, M, is a mild, self-limiting, potentially recurring, mucocutaneous inflammatory condition. The disease is characterized clinically by target lesions, which can be described as annular erythematous rings with an outer erythematous zone and central blistering sandwiching a zone of normal skin tone. It typically presents in a symmetrical distribution of lesions over the dorsal surfaces of the extensor extremities with minimal mucous membrane involvement. The lesions usually erupt over 24 to 48 hours and last for 1 to 2 weeks. It is generally related to infectious diseases and not drug exposure. The most commonly associated infections are herpes simplex virus and Mycoplasma pneumoniae.